I'm going to summarize a systematic review and meta-analysis that I helped to co-author and publish in 2023 that looked at patients undergoing hip and knee arthroplasty surgery and the effect of closed incision negative pressure therapy with Prevena therapy on their risks of developing surgical site complications. We found 12 studies, 4 prospective randomized controlled trials, 2 prospective studies, and 6 retrospective studies that looked at clinical outcomes of patients undergoing hip and knee arthroplasty. I think the 3 most important takeaway learning points from the study are that patients who received Prevena therapy following their hip or knee arthroplasty procedure were at a significantly reduced risk of developing a surgical site complication. That relative risk reduction was about 67%. These same patients were also at about a 60% reduced risk of developing a surgical site infection. And overall, they had a 58% reduced risk of needing a reoperation. We looked at secondary variables as well, specifically looking at different types of wound complications that might develop after hip or knee replacement surgery. And we found that patients who received Prevena therapy had about a 53% reduced risk of developing a seroma, a 62% reduced risk of developing a wound dehiscence, and a 60% reduced risk of developing prolonged wound drainage. One of the neat things about this study is that we were able to do a healthcare economic analysis from the data we gathered from these 12 hip and knee arthroplasty studies. And what we found was that by reducing the risks of reoperation and wound complications, Prevena therapy was associated with an approximate $930 savings per patient. Prevena therapy has been a really beneficial tool to my practice. I've been using it since 2014 in patients who are at particularly high risk of developing a surgical site complication or surgical site infection after hip and knee arthroplasty. And what I've seen is that when I've used it, it's been a very successful tool at taking that risk and reducing it to a more manageable level. So while this paper focused on patients who were receiving hip and knee arthroplasty surgery specifically, I do think this data is more widely applicable. There are many other studies that look at the use of Prevena therapy in other surgical subspecialties and find very similar kinds of results in managing high-risk patients.